Okay, so welcome everyone. A couple of housekeeping items. I just ask that everyone keeps their microphone on mute. If you have any questions, you're welcome to pop them in the chat and I will direct them to Andrea for you. And once again, this webinar will be recorded. And we will be sending everyone a link later this week if you miss anything. In the spirit of reconciliation, the Ultrasound Education Group acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders peoples today. Again, thank you for joining us tonight. I'm Elizabeth Hurley, the manager of the Ultrasound Education Group. I've been working closely with Dr. Andrea Bauer and our team of authors to develop this new course. Joining us today is Dr. Andrea Bauer, the course coordinator for the Graduate Diploma in Perioperative Medicine. Andrea is a consultant anaesthetist at the Royal Melbourne Hospital. She is also a clinical senior lecturer and director of the clinical ultrasound within the Ultrasound Education Group at the University of Melbourne. Andrea's PhD addressed the importance of the assessment of quality of recovery and validated a tool with which to equip perioperative physicians to assess patients within the perioperative period. Andrea is passionate about the two evolving areas of perioperative medicine and clinical ultrasound and teaching the necessary skills required for these areas to practicing clinicians. And now I will pass over to Andrea.
Thanks, Liz. Good evening, everyone. Thank you for joining us this evening in a very busy time of the year. We will discuss this exciting new course that we are developing and will be launching in March of 2021. I wanted to discuss two things with you this evening. First of all, why should you do this course and what will you get out of it? Let's look at the why. Why should I do this course? Well, as you know, we have an ageing perioperative population, so that by 2051, over 50% of patients undergoing surgery will be over the age of 50. And we all know with increasing age comes increasing complexity, perioperative morbidity and mortality. Alongside this, we've had an explosion and a rapidly evolving advances in both the hardware and the software of point of care ultrasound, such that almost by every patient bedside, there is a point of care ultrasound probe. Alongside that, there's emerging evidence that the actual use of these ultrasound probes results in improved clinical benefit in terms of driving patient management, diagnosis, and outcomes. So let's look at the second. What shall I learn from this course, or what should you learn from this course? Well, this course consists of two stacks of subjects which have separate learning outcomes, so which while separate are also complementary and intertwined with each other. The first stack of subjects looks at basic skill acquisition and ability to interpret point of care ultrasound. And these skills can be directly applied to your perioperative patients. The second stack of subjects takes these skills that you learn in the first stack and intertwines them into integrating them into the field of perioperative medicine, which is a newly emerging specialty in its own right. The second stack consists of 4 subjects: preoperative optimization and risk assessment, ERAS and bundles of care pathways, diagnosis and management of perioperative complications, and then patient-centered recovery, patient safety and team leadership. What you'll be doing will consist of e-learning tutorials, MCQs both at the end of the tutorial and end of semester, case studies to integrate what you have learnt in these tutorials, and in one of the subjects is a practicum as well. I and the rest of the team want to really reiterate that we're really excited at developing this innovative course that actually intertwines the two developing areas of perioperative medicine and ultrasound, that has the benefit to provide tangible clinical benefits to your patients. Thanks, Liz.
Great, thanks, Andrea. So as Andrea said, the course is made up of 2 awards. you must complete the graduate certificate in clinical ultrasound in order to progress to the graduate diploma in perioperative medicine. As you can see, the graduate certificate has one core subject, principles of ultrasound heart scan, and then you can choose any 3 electives from that course. And then we have the 4 subjects from the graduate diploma in perioperative medicine that Andrea has already spoken about. Entry requirements for the course are either successful completion of the graduate certificate, or if you're starting with us as a brand new student, an undergraduate degree, a Doctor of Medicine, or a Bachelor of Medicine, Bachelor of Science, MBBS. Again, if you've completed the graduate certificate in clinical ultrasound, or the graduate diploma, or the master's, you get direct entry into the graduate diploma of perioperative medicine, and you get recognition of prior learning for the 4 subjects you did at the graduate level. For the full 8 subjects for the graduate diploma, the fee is $18,816. And if you only need to do 4 subjects, then it's $9,408. One of the best things about our course is it's online, and you can study at your own pace at whatever time is convenient to you. And we've developed the course so it's able to be viewed on your phone, on a tablet, or on your computer at home. So it does provide a lot of flexible study for everyone. Some important dates to think about. Semester 1, the teaching period starts on the 1st of March. The last day to enrol is the 12th of March, and enrolments are open now if you wanted to get in early. The census date is the 31st of March. This is the last day you can withdraw without financial or academic penalty. And then exams will start on June 7 and finish June 13. The exams are all online, and you can start them at any time during that week and take as long as you want during that week to complete the exam. So again, there's a lot of flexibility there. So that really concludes our presentation. So we can move into questions now if people have any questions they want to ask that we may not have already covered. You're welcome to just type them in the chat and I will address them to Andrea. I have one question here. So Andrea, what makes this course different to other perioperative medicine short courses?
Thanks, Liz. Well, there are multiple perioperative medicine courses being run, and each of them have their strengths. This one really is unique in that it actually addresses the 2 rapidly developing areas of perioperative medicine and clinical ultrasound, and really tries to provide students both with the knowledge of current issues in perioperative medicine, but with a new skill set, which is the ultrasound and the point of care testing, which in the literature is really showing to improve patient outcome, to really drive clinical decision making and risk assessment. So that's what we think is one of the strengths of this course, is that it is interweaving this new technology and this new knowledge into another evolving area, which is perioperative medicine.
Great. Also, what is the focus of the perioperative medicine subjects?
I think that is coming on from that previous question, which is that the perioperative medicine, the 4 subjects want to address the entire perioperative period and the patient experience. So preoperative risk assessment, preoperative optimization, the emerging role of bundles of care pathways and the evidence behind those, post-operative period complications, and then the more high-level concepts of patient safety, team leadership, and integrating the patient into a holistic model of care. They're the main focus, and throughout all that will be the application where appropriate of this the point of care ultrasound.
Great. We have another question. So someone's recently just completed the graduate diploma in clinical ultrasound. Congratulations. And the question is, would I be gaining a second award of diploma if they were to complete the graduate diploma in perioperative medicine? And the answer is yes. You would only need to do 4 more subjects at the graduate diploma perioperative medicine level, and you would have 2 awards from the University of Melbourne. It is true. Another question. So Andrea, can you repeat the assessments involved and their weighting or the marking allocation?
Sure. So the foundation, the core knowledge is the tutorials, and at the end of each tutorial there is a set of MCQ questions, and collectively they are weighted over the course of the subject to 20%. You also have a number of case studies which they have activities associated with that, and MCQs, which as a group of case studies contribute 40%. The end of semester examination is 20%. There is a hurdle requirement also for a contribution of a case study, which isn't marked, but actually has just a hurdle requirement. And sorry, the end of semester MCQs are 40%. And in the subject 4, instead of the hurdle requirement, we have the completion of a practicum.
Great. And also the question then continues is, what is the estimated time commitment per week? Yeah, sorry, go ahead, Andrea.
No, you take this one.
Oh, so it depends if you do full-time or part-time, or you can even study 1 subject per semester if that fits your lifestyle better. So each subject is 12.5 credit points, and there's approximately 10 to 15 hours a week per subject. So yeah, you really just have to decide what's the best way. A lot of our students actually do a maximum of 2 subjects per semester, and they find that works well for them. Great. And then we have another question. So is the course solely adult-based, or is there some pediatric components?
I might take this one. So the overwhelming majority of tutorials are with regard to adult medicine. There are some tutorials that address obstetric, perioperative issues and pediatric issues, but from the standpoint of a non-obstetric or non-pediatric care physician. Those subjects are more to give a breadth of knowledge of applications of periop med and clinical ultrasound.
Great. I don't have any more questions that have come up, but if anyone does think of any questions, I'm more than welcome to email. Oh, sorry, I've got one. Have ANSCA or the Periop SIG had input?
So this isn't an ANSCA accredited course as yet. What we have approached them and they're aware of it, and it goes complementary to the other courses that are around.
Great. Okay. What is involved in the hurdle requirement?
So the hurdle requirement consists of logging a few case studies, and the case study meaning basically a description of a perioperative patient that you may have had, obviously de-identified, and then just addressing succinctly the perioperative or preoperative or post-operative issues that were encountered.
And then the follow-on question to that is around the practicum. Could you give a bit more explanation around that?
Sure. So the practicum is in subject 4, and it's instead of the hurdle requirement and reduced case studies. And what that consists of is logging and assessing patient post-operative quality of recovery using an online platform. And what you do is you input your patients and then track their recovery throughout the perioperative period. So it's application of the perioperative quality of recovery scores.
Great. And then we have another question just about minimum time frame to complete the 8 subjects. So there isn't really a minimum time frame. Generally, the University of Melbourne asks people to work at 2 subjects a semester, but at a graduate level, you can actually take it down to 1 subject a semester, and then you can also take leave of absence if you need to have 1 or 2 semesters off during that period. So there isn't a minimum. There will be a maximum time frame, but I think we'd be looking at something like 5 years. So yeah. We have another question. So this person's undertaken the Masters, 1 subject in semester 1 and then 3 subjects in semester 2. So that's actually incorrect. We are publishing 2 subjects in semester 1 for 2021. So you could study 2 subjects in semester 1 and then 2 subjects in semester 2. And still have it completed by the end of 2021. Our next question, would this case be suitable for surgical registrars? Sorry, with this course?
The simple answer is yes. We are catering a course for anyone involved with the management of perioperative patients. Each person will bring to their course a different knowledge skill set. But it is very much applicable to surgical practitioners, to anaesthetists, intensivists, ED, peri-op physicians, primary care providers. And in the second subject is actually addressing ERAS and bundles of care pathway. And throughout the course, a lot of the, or a fair number of the tutorials are actually written by our surgical colleagues.
Great. To see if we have any other questions. Okay, so I think I have someone who actually wants to ask a question. Alexander?
Yeah. Could you hear me?
Yes.
Right. What would an ICU component of that course? If you're doing sort of ICU, I'm a consultant anesthetist. I've been involved with ultrasound teaching and support and been using for a while. And I'm most interested in intensive care component of course. Is it sort of involved as well? Practical application, you know, in this sort of critical patients in difficult conditions. And
so the answer is yes. I'm just thinking through the subjects, is it's not limited to a patient undergoing an anaesthetic. We do have preoperative assessment, but it's looking at the optimization of organ systems, so heart failure, respiratory, hepatic, renal. So that's directly applicable to patients who have either undergone surgery or are critically ill. Yeah, and also in the post-operative subject, there is looking at, you know, diagnosis of deep vein thrombosis, etc., which are directly applicable to any critical care patient.
Great. So again, if anyone has any other questions that we haven't addressed, you can always email us at mobile-learning@unimel.edu.au, and I can have Andrea address it, or depending on what it is, I can also answer the question. As I said earlier, we will be emailing everyone later this week just to provide them with the link to this webinar, but also the link to enroll if that's what you wish to do. But you can also ask us any questions based on that. So Andrea, did you want to say anything else before we leave?
No, that's it.
Okay. Great. Well, thank you everyone for joining us tonight, and I hope you have a great week.